Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the CCS-P, or the Certified Coding Specialist Physician-Based, or the CPC, the Certified Professional Coder. Which one should you take? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, trying to decide which way to go. The CCS-P, which is a credential offered with the American Health Information Management Association, or to go with the CPC, the Certified Professional Coder. And if you are brand new to medical coding, you will have the -A for apprentice, unless you go through an approved AAPC program and you also take Practicode, which is also more money that you have to spend, and we'll get into that in a minute. But if you don't have any experience, you will start off with an apprenticeship, and that will be on your credential for the first 2 years. Now, there is nothing wrong with an apprenticeship. There's nothing wrong with having the apprentice status on your name if you are a CPC. There's nothing wrong with it. People still get jobs with it, okay? There's nothing wrong with it, regardless of what anybody tells you. I am a veteran medical coder who has been around for a long time. I have nothing to sell you all. I have a growing YouTube channel because I keep it real and I keep it honest. And again, if you are being told that, oh no, you have to get that apprentice status, hurry up and remove it. And, when you remove it, you can make all this money. Guys, here's the thing. A lot of people are being guided which way to go by money when it comes to these credentials. But I will say this, the CCSP and the CPC both cover outpatient medical coding only, okay? So that's the first thing you gotta know. A lot of programs will start their training with outpatient coding. That's the CPT manual, or the current procedural terminology manual. And it will go over the outpatient rules, and it will talk about outpatient coding, the coding in the clinic, or profi coding and those kinds of things, right? So that's all of that. But when you start getting into the inpatient side, that is something completely different and not what I'm going to talk about on this episode. Here's the thing. When if you call AAPC, of course, they are going to encourage you to get their credentials because you called their business. You call their business, you ask them about their credentials, and of course they're going to say that this is the best. That would be the same as if you called AHIMA and asked them about their credentials and everything. It is up to you, not up to a salesperson, right? Which credential should you take? You only need one. You do not need both. Regardless of what anybody tells you, you do not need both. If you look in the job listings, you will see that the CPC gets asked for, the CCSP gets asked for. So with that in mind, you want to just use your own agency to pick which one you want to go to. Now, I will say this, there are differences in the associations, differences meaning in their fees, okay, for either one. There are differences which will impact you in the long term, because with AAPC, you have to be a member of their association every single year you hold your certification. If you do not pay for your certification fee, they will take your certification away. Period. Not only that, it is 36 continuing education units for one certification. With AHIMA, the CEUs, or continuing education units, for the CCSP is 20, okay? You do not have to be a member of AHIMA. It does help, but you do not have to be a member, right? And because you don't have to be a member, you do have to pay a separate fee, which is not as much, right? But you do have to pay a separate fee for reporting your continuing education units. And that is just the fee that you have to pay. So, to report them for like their administrative costs and all that other good stuff. But you have to pay that in order to maintain your certification, and that's understandable. But you don't have to pay a membership fee like you do with AAPC, and you have to pay this every single year. Now, if you decide to go the AAPC route and you didn't go through an AAPC approved program, maybe it was just like a college and they said, okay, we can prepare you for either AHIMA or AAPC, and you decide to go with AAPC, you could purchase Practicode, which is like $249 if you're a member, and it's just a batch of 660 real-world redacted cases, and you're just coding this, right? And this is their equivalent of 1 year of work experience. This is the association's equivalent of 1 year work experience. This is not hands-on work experience, no matter what they try to say it is. This is just them giving you an education that's extended from your program, obviously, because you are going through these 660 records and you are coding through these specialties. And that's how you're learning. These are not multiple choice. You're having to code these out yourself. So with that in mind, once you complete that, you can have 1 year of the 2-year time commitment down to 1. So if you are working and you find a job in coding, right, with the CPC-A, again, it is possible, but you get a job and then you're doing Practicode, then you can have that apprentice status removed within the first year. Now, if you decide not to do Practicode, you decide to save your money, all right? Because if you want to get additional practice, you certainly can. All of the books I've always recommended, they're in the description box below, along with the independent study link that lists more of the books that I do recommend. Guys, you don't have to spend all this money. This is a thing that it sickens me to my core when I see new people being taken advantage of. And it's just like, no matter how much I tell you all, sometimes I feel like I'm just shouting into the wind, because it's like you're in this trance of, no, I have to spend this money in order to get my credentials. With no experience, I'm going to have a bunch of different credentials after my name because this is what they're telling me that I need to get hired. Untrue. This is not true. I had one credential for 13 years. I had the CCA, right? I had the CCA, the credential that a lot of people don't understand, right? But I had the CCA for 13 years and I had many wonderful jobs. I got 4 with it, okay? 4 jobs with my CCA. I have made a lot of money with my CCA. I currently hold the CCS and the CCS-P only because I got the CCS-P first and then I got the CCS. So yes, I'm going to hold both of them. But that out of the way, I'm an experienced medical coder. Okay? If you are brand new, all you need is 1 certification. You do not need to be pushed into getting a bunch of different credentials that you're already being tested on with the CPC. The CPC covers reimbursement. You don't need the CPB. It also covers all of the other specialties, so you don't need those other specialty credentials. If they're telling you, oh, if you get this auditing credential, that's going to make you look really good. You have no business being an auditor when you have a CPC-A. This means that you don't have experience. You need to have experience. And yes, I know the CPMA is something completely different from like auditing, but it is still auditing. And either way you go, whether you are auditing the records or whether you are auditing other medical coders, which that has nothing to do with that, but either way, you have no business if you're a brand new medical coder doing auditing when it comes to that kind of thing. That is for people who have experience. If you do not have experience, don't get it. I had somebody who had a CPC-A tell me, oh yeah, I just sat and passed for my CPMA. Okay, well, what are you going to do with it? Well, I don't even know what it is. Why are you getting something and you don't know what it is? Risk adjustment. Again, it's already being tested when you're taking the CPC, right? It's testing you already on diagnosis coding. And if you are not really proficient in pathophysiology, again, why are you trying to do risk adjustment? Now, risk adjustment is a great place for people to start when they're brand new because it is just diagnosis coding. However, you can't get stuck in there because it is just diagnosis coding. You do need to have experience coding evaluation and management. You have to have experience coding in procedures coding. So you're going to need to limit your time. If you're going to start with risk adjustment, you really do need to limit that time to like the first few months, but still continue to look for other medical coding jobs that are going to give you that exposure to evaluation and management coding and procedure coding. Because again, I've seen job listings that say if your only experience has been in risk adjustment or like coding for like physical therapy, because there's only certain codes that are used in physical therapy, right? And occupational therapy, that doesn't count as experience to those employers. So there are some employers who do say that. So that's just something that you guys got to know. If you don't believe me, check the job listings, guys. I check them because it's my business to check them because of my channel. I have to be on the lookout for what employers are looking for so that I can bring you guys solid information. And that is what they say about people who start with risk adjustment, okay? It's a great place to start just to get your foot in the door, but it is not a place for you to stay, okay? But that's just my advice to you all as brand new medical coders. So getting back to the subject at hand. So if you want to go with the CPC, a lot of people say, well, Blue, I like the camaraderie the AAPC seems to have. Then that is totally fine. You want to spend your money on the association, paying their dues and doing all these things with them, that is totally okay. But I hope y'all hear me when I say you only need to start with one certification and you don't have to rush to get that apprentice status removed, okay? It is just a designation that they have on their certification that says that you are brand new, and that is it. And Practicode, again, does not count as work experience. I don't care what anybody tells you. It doesn't. What it is an educational product, and that you have to understand. Some employers will take education in lieu of experience. So whenever I do resume rewrites, and my rate is in the description box below, if you are interested in that, again, you can contact me below. But for people who are writing their resumes themselves, I always put this on the education portion. I never put this down as work experience, and I never put this down as an internship, okay? Because it's not. All it is an educational product. That's all I'm saying. Now, the CCS-P, the Certified Coding Specialist, physician-based. This is AHIMA's outpatient certification exam. This says that you have mastered the outpatient setting. This says that you know outpatient medical coding, your CPT manual, your evaluation and management, and all of your outpatient rules. So if you have gone through a program that is preparing you for the CPC, you certainly can take the CCS-P if you choose to go that way. Okay, guys? There's nothing wrong with using the association's programs for preparation for the other side. Just because you go through the AAPC online program for outpatient medical coding and then you decide to take the CCSP, that is totally fine, as long as you have prepared yourself. Now, the outline of the exams is on both sites respectively, right? So check the domains and check to see if what you have been studying has been covered, right? And so if it hasn't, then you know that that's where you have to go and you have to study more. These exams are very rigorous and they're very difficult. Now, there are some schools that will teach exam strategies on how to pass the exams, particularly with AAPC. They do that. I have a comment from a viewer who talked about that. And I'll be addressing that in another video. But the thing is, when it comes to these exams, no matter if you are using exam strategies to get your way to just pass the certification exam, that's still not going to prepare you for the real world. Because while you have while you have passed this first part, it doesn't necessarily mean that you're going to pass those assessment tests when the employers give them to you. Now, you will have an assessment test at all the places that are going to give you like an interview and that, you know, they are potentially interested in you. So that is something that you got to be aware of. You have to be ready for these assessment tests. And if you ask me, well, Blue, how do I get prepared for these assessment tests? Every place is different. Every single employer is going to have different needs. If you are applying at an orthopedic sports medicine place, obviously you're going to need to be aware of your injury coding guidelines and your musculoskeletal system and everything like that. So that's what you want to make sure that you know walking in. Same thing if you are going to like a cancer therapy research center. You need to know about neoplasm coding. It's using common sense when you are going to these places and you are applying, okay? I know if I'm applying at an OBGYN, I got to study up on my mother-baby guidelines and mother-baby coding. You know, it's using those things and then understanding the basic fundamentals of your coding guidelines. Again, the thing that I tell you all the time to do is review those guidelines. So either way, if you're prepared for the outpatient side, testing. You can go with AHIMA or you can go with AAPC. AHIMA, again, does not require you to be a member. They do have a separate cost for members versus non-members, and you can see that on the AHIMA website, ahima.org, and I will leave that that website in the description box below, along with AAPC's, so that way you guys can go and check it out. I will not answer questions that are specific to the associations. A lot of times people say, well, does AHIMA allow this or does AAPC allow this? Guys, do your research. Go to the website. So that way you can start learning to do your research. You know, it is about learning to do your research. I've answered these questions many times, and sometimes people just don't get it or they just don't, you know, they just don't respond at all. So it's just like, okay, you know, I tried to help, but whatever. The CCS-P is a great credential. There is no apprentice status on this at all. You will know your test results as soon as you walk out of the exam room, right? We take our exams with AHIMA. We take them at Pearson VUE. So no matter what certification you're sitting with AHIMA, the test is administered at Pearson VUE. That is a third-party testing center. And so when you log in and you take your exam and you come out of there, they will have your results printed out. And so you'll know if you passed or if you failed. So then, you know, you can go from there. But the day that you get your certification, I mean, obviously, you don't have to wait till you're certified to start applying, but having a certification does get you noticed a little bit more because, you know, employers do want their coders to be certified. If you get hired before you have your certification, do not expect them to pay you like a certified medical coder, though. That's the only thing that you got to be aware of. That yes, you may still already be getting that experience, but you may or may not start off at the same salary as their certified medical coders do. Or they may tell you that we will hire you since you completed your program, but we are expecting you to be certified within X number of days or X number of months, you know, and so always take that into consideration. But yes, you can be proactively looking for a job, certainly, before you take your certification exam. But when you take your certification exam and you pass it, in the instance of the CCSP, you'll know right away if you passed or failed, and you can be out there and you can start applying and with your designation on there, with your CCSP. Whenever you are, just a little tip for your resumes, if those of you that are writing your own resumes, when you are putting your name, you need to have your certification with a comma next to your name because they need to know who you are professionally. And so you are allowed to have your certification designation obviously after your name. So you want to make sure that you do that so that you can identify yourself right away with what certification you do have. So it is a personal choice, whichever one you decide. I will say this in closing, that one is not better than the other. If people are telling you, oh, well, the CPC is better, no, they are wrong. Oh, the CCSP is better, no, they are wrong. It is on the individual medical coder. I have seen people who have any of the medical coding certifications, CCS, CCA, CCSP, or the CPC. I've seen people with one of these each, and they don't know a hill of beans on how to code. And I'm with AHIMA, and I can say that. And I've seen people with AAPC credentials that can't code to save themselves either. So it's not just, you know, for, you know, just, oh, this certification, you know, whatever. No. It is all medical coders. You have some good medical coders and you have bad medical coders. So there are coders who have certifications that they just kind of fumbled their way through the exam and they just fumbled their way into a job. And so that is how they are in there. But it doesn't necessarily mean they know how to code. Okay? So if the person is not trying to learn, again, it doesn't matter how many certifications you hold. If you do not have that continuous desire to learn, or you don't take the time to learn, there's not really a lot that you're going to be able to do, okay? And even if you do have a job, okay, everything that you code, you are responsible for. You are held to standards. We have the AHIMA standards of ethical coding that everybody follows, okay? Everybody, regardless of your certification status or what sort of association you belong to, We all follow these AHIMA standards of ethical coding. And you do need to properly code at all times. And you do have to study, and you do have to make sure that you know what you're doing. So that being said, guys, there is not one that is better than the other. It is on the medical coder. And I don't want to hear that, oh no, this one, no. It is on the individual, because again, if you don't know, and I can spot a liar when it comes to, oh yeah, well I know this and I know that, just by listening to them. And just by listening to how they explain things, I can tell, because I've been in the field long enough to know that I don't know everything, but I do know how and which way these codes should be going. So that is something that you need to realize and think about, is that it's not about the credentials that the people hold. It is about how much knowledge that individual has. I've had one credential for many years, and trust me, I ran circles around people who have degrees. I ran circles around people who had multiple certifications, that at the end of the day, that's not going to give them the knowledge like I have the knowledge. So concentrate on, making sure that you understand what you're getting yourself into. Concentrate on one thing at a time. Wait at least 2 years before you start trying to rack up additional credentials, because at least this way it'll give you time to get in there. There is no job listing that says candidate must have multiple medical coding credentials to get this job. There is not one job listing that says that. What are they looking for in the jobs? When candidates are applying, experience. That's what they're looking for. And if they can't get people who have experience, then they're going to look at knowledge next. I'm just saying. So I'm going to wrap this one up. Either way you choose, you're going to have a good credential to start with, either the CCS-P or the CPC-A, so either way, you just need the one. That's all you need. So I hope this helps. I'm going to wrap this one up. Thank you guys so much for joining me. If you haven't had a chance to like and subscribe, I hope that you do, and I'll see y'all next time. Bye.